of the biggest issues facing healthcare in general is to ensure that we can meet the needs of the community. The needs of the community are increasing, particularly for a hospital like Northern Health.
Northern Health is one of the busiest hospitals in the state. We have a large catchment area and we're in one of the biggest growth corridors in the country.
The problems at Northern Health that we face every day on the wards is basically about access and flow for patients. So moving patients through the wards in a timely fashion and getting them discharged home and giving access to beds for people from emergency or for elective procedures.
The Toyota production system is basically a set of techniques that Toyota's used over the years of its manufacturing to really improve and take the production concepts to really the next level, to be world class. Over time, we've actually shown that the techniques used within that system can be applied on a much broader scale than just automotive manufacturing.
I think the problems have been there for a long time and we've always tackled it in different ways. With Toyota, they showed us how to pull the problem apart. Rather than automatically coming up with that solution, we think we know what's best. We try what another hospital has done, with it not being the best fit for our hospital.
We were able to map out each step of the patient journey and actually identify any areas of stagnation, inefficiency, or where there was particular staff frustration or patient dissatisfaction.
From the patient's point of view, one of their biggest areas of dissatisfaction was feeling like they were being dumped in the transit lounge. So some patients were waiting up to 8 hours in transit lounge, where we were showing that they could be out within 60 minutes. We identified 3 key changes that were going to be implemented on the ward. So the first one being around the visualisation of patients on the ward.
For discharge planning, we have a patient journey board. So a patient journey board is a visual aid that we use that gives us basically like a patient status at a glance. And we try and identify what barriers are to discharge.
The second change that we've implemented is around levelling the workload. We realised that you can't discharge more than one patient at a time. And what was happening is doctors were doing their ward rounds, they were finding all the patients that needed to be discharged, they were writing all the discharge summaries and sending them all at the same time.
When you have 5 discharges all at once, there's no prioritisation, so pharmacy doesn't know who to do first. And the predictability also helps with the admission flow, so knowing when I'm going to get a bed likely to be available, then it helps when I'm going to get a patient up.
Another change that we've implemented is around standardisation. So we have a daily MDT or multidisciplinary team meeting where support services like pharmacy and physiotherapy, nursing, your patient attendants all come to a meeting every day and discuss the patient's acuity, barriers to discharge and possible discharges for the next day.
There was always the want and the will, but there wasn't necessarily the tools and the systems to know how to innovate in healthcare. And I think that's something that we've learned through this process.
Toyota's taught us that it might be working for you, but what else could you do to make it better? Staff are now empowered to challenge if something's not right, and they'll actually feel engaged in improving something, and they're open to actually being part of that improvement process.
As a major healthcare provider, we have a responsibility to make sure that our processes are efficient. And I think with the partnership with Toyota, we can build towards that efficiency and continual improvement to make sure that we can serve our community in the way that it deserves.